When they picture postpartum depression, even people that have had kids and picture postpartum depression think can't get out of bed, somebody has to take care of the baby. I think it's important for people to talk about all the different ways that it's really a continuum and can look different. I feel like moms always fall through the cracks with medical stuff in general, and especially with pregnancy and postpartum. It's like women are supposed to have tight abs and flat stomachs unless you're pregnant. Then you're still judged on your baby size and how big your bump is. It's like you can't win, and so there's always shoulds. A happy mom, a well cared for mom makes for a happy baby and a well cared for baby.
Dear young married couple, you're in a busy season of your life. You're probably working and involved in ministry. On top of that, you might even be parents or students. You're maxed, but you really want to stay connected in your marriage.
And that's why we're bringing this podcast to you.
I'm Adam King.
And I'm Carissa King, and we work with busy couples just like you in our counseling office here in Sacramento, California. We also work with couples all over the world through online counseling, and our couples are really just looking for ways to communicate with each other more effectively. Some of them are looking to heal from a breach in trust or find direction in fulfilling the purpose that God has for them.
So come and join us as we have a conversation. We'll talk with therapists, authors, pastors, and other couples who will pour into us, giving us tools to become more intimately connected, get adventurous, and find purpose.
Welcome to the Dear Young Married Couple podcast. Did you know that 1 in 7 women are going to struggle with postpartum depression?
Yeah, and that number is quite conservative. It could be a lot more. But that means that your wife, your sister, your friend, or maybe even you are struggling or have struggled with postpartum depression. And so we're going to cover that today, the baby blues and what to do.
Today we're interviewing Sarah Sanders, who is a licensed marriage and family therapist.
And Sarah has a master's degree in counseling psychology, and she also is a certified perinatal mental health specialist. And side note, I actually go way back with her. We talk about that in the interview today. And she's incredible. She has a lot to share with us, not only about postpartum depression, but also postpartum anxiety, the subset of postpartum OCD, and postpartum psychosis, the difference between those things. So you're in for a treat, also in for a lot of good direction and support for how to deal with this if you or somebody you know is going through it. So welcome, Sarah, to the podcast.
Hello, Sarah.
Thank you so much for having me. It's so good to see you guys.
Oh, absolutely. It's so good to see you too. And for those who are listening and are wondering who's Sarah and what's the connection here, Sarah and I actually go way back. We went to graduate school together back in 2000. We started in 2010, right?
Yes.
Yeah. And then we were graduated practicing by 2011, end of 11. Yeah. And man, you've built your own practice.
Yeah.
And you are specializing in perinatal mental health. Mm-hmm. And so you have a lot of wisdom to share with our audience today.
Yeah. So when I first started 10 years ago, I saw everybody, men, couples, just kind of, remember at Reflections, anybody who came in was who we crossed,
Yes.
So that's kind of what I did. And then about 4 years ago, I just decided to start focusing solely on women and girls and just have my whole practice be that. So that's all I see. And some families and, different support people, pulling in. But yeah, I'm, perinatal mental health is very near and dear to my heart. Mm-hmm. I cared about it before I ever even had kids. Then after kids, I especially, was like, okay, yeah, this is important. So yeah, I love the work. I love supporting moms and just being, there in that capacity for them. And so, a lot of people, when they picture postpartum depression, even people that have had kids and picture postpartum depression think it's this really specific, like can't get out of bed, somebody has to take care of the baby. So, I think it's important for people to talk about all the different ways that it's really a continuum and can look different. They can have a lot of anxiety and not any depression. It's kind of a misnomer of just postpartum depression, because there can be anxiety in there. So
Right.
it can really like just span a lot of symptoms, and, even moms, that they really want support and extra help, but their anxiety is telling them to kind of hold on to the baby more and not trust somebody else, not even the, the spouse or the partner. And so it can look like they're controlling and, whatever, but really it's this fear inside and this anxiety that can manifest that way. So
yeah. Wow.
As like, let's say somebody comes into the office and sits down, you kind of start to get the idea that this is postpartum. They just had a child, and you could see the signs of depression. What is your typical move, or how do you start like helping somebody see what's going on in themselves? And then what's the process?
Yeah, it's pretty complex because typically I don't just get a referral from, I can from a midwife or doctor, but typically it's somebody coming in that they're just like, this woman's just like, I don't feel good, or I'm not sleeping, or I'm irritable, or I'm, whatever. And I don't know what's going on, so it's kind of like, I picture kind of like this big ball of yarn that's not stuff. And it's kind of like teasing it and pulling it apart and being like, what is going on? What is this, underlying issue going on here? And so, if they've had a child within a year, or even if their kid's 10 years old, I'm still kind of assessing to see maybe they had postpartum depression, maybe there's some unresolved stuff going on. A big part, I think, as a mother is this mom guilt and this mom shame that we feel. I'm sure you can, relate to that, Krista.
Oh yeah, for sure.
The shoulds, I should do this or I shouldn't do that, and so just in general, there's a lot of pressure on us moms. And so, if somebody has a kid or a baby, and I'm definitely assessing that. And a lot of times, there is some postpartum depression that was there or is currently there. And so I'm really just trying to get a full assessment and a picture of what their life is like, eating, sleeping, their support systems. If they've met with a doctor, how they feel about meds or something natural, to support it, just kind of taking that ball of yarn and slowly, that can be several sessions. So it's really, and I do more insight oriented work. So I work with a lot of, my clients I've seen for years now. And so it's a long-term, addressing lots of different things, but the postpartum piece is huge, and people don't realize that, it's,
and it's so common. Do you know how common it is? Like, what's the prevalence rate for postpartum depression or anxiety?
Yeah, they say for perinatal, which is like when you're pregnant and postpartum, that it's about 1 in 7 to 10. So it's like 15%. But I personally, obviously I see it a lot more in my therapy practice, but I feel like it's underreported, and, people just don't know. And what's really hard is that when moms, when you're at the hospital or whatever, giving birth, whatever location, a lot of the focus is the baby. And so the mom kind of gets pushed aside, and especially her mental health. And so then she gives birth, and then it's all checking about the baby. And then your follow-up, postpartum visit is not like for 6 to 8 weeks, and so it's like a 10-minute visit. So how are they even, how's the medical professional even going to see if that mom presents with a full face of makeup and she looks really competent and she's really struggling inside?
Well, that's what she should do, right? That's what she should have done, right? Like,
yeah, exactly.
Pull yourself together. Yeah.
Totally. Yeah. I need to have a certain look. My baby needs to look a certain way,
I have to have it together.
Yeah.
Yeah. And so if she presents that way, the medical professional might not know or think to be like, here's, the Edinburgh postnatal, depression scale or whatever, and really like ask her deeper questions. So it's hard. I feel like moms always fall through the cracks with medical stuff in general, and especially with pregnancy and postpartum.
So if you were a medical professional right now talking to a whole bunch of women and screening, what questions would you ask them to elucidate that answer, or to find out where they are in their mental health?
Yeah. Well, more specifically, questions of like, are you, how's your appetite, or are you eating? And somebody's like, yeah, I eat, but like, when are you eating? How are you eating? You know, are there any periods where you're not feeling hungry, or, you know, are you eating too much, you know, or too little, you know, it just kind of going very kind of in depth, because even with like sleep, it's like, okay, how's your sleep? Okay, well, the baby wakes me up all the time. But after the baby wakes you up and you get the baby back to sleep, are you falling asleep? Or are you staying awake for hours? You know, just kind of like that. So, you know, it's very time consuming, you know, to go through that. And, you know, a great resource is Postpartum Support International. And I just finished all of their perinatal, you know, mood and anxiety, specialized classes and trainings. And the one trainer was saying like the full screening of what every, you know, medical professional should go through, and, you know, all the details. And it was like an hour of questions and stuff. And it's like,
oh, wow.
People don't spend, you know, I didn't have that much time when I was, you know, pregnant.
No way. I think I got like the PHQ-9, like it's 12 questions, you know?
Yeah, exactly. Yeah. And then if you have that pressure and you kind of have that should on you, that I should be competent, I should, you know, then you're like, oh yeah, I'm sleeping. Like, this is what I should be doing, or, you know, so it's hard. I think it's that whole, it's not like the medical professional's fault, or it's not the mom's fault. I think it's just a really hard, like unfortunate mixture of like lack of time and resources. And then that mom having those follow-up questions, because maybe that day she is feeling good, but, you know, 5 out of the 7 days she's not, you know, and how do I answer this? You know,
what's normal? Do you think, like, for women maybe trying to figure out, oh, maybe I need to be seen for this? What's, you know, like normal for saying, like, I know normal is such a hard word, and it's not a one size fits all. I get it. But like, you know, I feel terrible for 4 out of the 5 days, or, you know, whatever you said, or out of 7 days. How should they reach out at that point, or what are we looking for here?
Yeah. Like kind of like what would be her indicator that she needs to reach out? Yeah. It's hard. I think really, you know, trusting your community that you have around you. So your partner or your friends, or, you know, if people start saying, hey, you look a little sad, or, you know, you're kind of stressed, like, I personally, thinking back after the birth of my first son, and I had a lot of anxiety of just like, I want to do the best and I want to care for him well. And so it kind of kept this like very kind of wound up internal dialogue that I had, that I didn't present anxious really, but inside. And so if people would have asked me more of like, well, what are you thinking with that? You know, that's what we do as therapists, but you know, if friends or family know to kind of check in more with the mom, and don't just go by how she presents and how everything looks. And internally for the mom herself to really just kind of like, I always tell my clients, like, just kind of sit with yourself. Like, how does your body feel? Where are you? What's your mind doing? If your heart racing, you know, kind of just like going inward, because as you know, being a parent, it's kind of fast paced, and it's this thing and this thing and this spill and that, you know, and this baby throw up and, you know, blow out, you know, there's all these things that you don't check inwardly with yourself very much. A lot of that internal, you know, mindfulness. And so if you are feeling sad, or you are feeling anxious, or you just don't feel right, if you feel a little bit off, or you're like, I just don't feel like myself, or I'm really stressed about such and such, like just reaching out and, you know, going PSI, Postpartum Support International has their specifically and specially trained therapists, but also just Googling, you know, going on Psychology Today, you know, asking a friend, you know, a family member, if they see anybody, you know, just kind of that network, and just going and seeing somebody. I think a lot of times we feel and I see this in my, practice a lot, that these women are like, well, I don't know what I have, so I need to figure it out before I go,
Right. Like they feel like they have to diagnose themselves in order to feel qualified to walk into your office.
Yeah,
and it's like, you don't have to feel quote unquote crazy. Like a lot of moms are like, well, I'm not crazy. So, but you can just go get support just because you're feeling off. And
it's funny though. I think some of the most fascinating and, some of the most fascinating work is with people that are high functioning, that are doing great, but maybe have some areas in their life that are difficult.
Yeah.
Right.
Mm-hmm.
So you don't have it together, but we also see a lot of people that don't have it together.
Right. Yeah.
It's the whole spectrum that's so interesting. And that's why this job is so interesting. So I guess I want to say like, you don't have to be any particular thing in order to reach out.
Yeah. You can feel like this is hard, or this sucks, or I thought it was going to be one way and it's not, and that's perfectly fine. Call a therapist, or, talk to a friend about it. You don't have to be like Googling, what things are and, having a preconceived idea walking in, and that's, my practice is made up of high functioning, anxious women. And that's what they do is like, I gotta get this figured out,
Yes. So Sarah, I guess I'm kind of maybe like asking most of the questions because I don't deal very much with this demographic besides my wife.
High functioning, anxious woman. Okay.
Sorry. But just thinking about, the shoulds come out so often, and that seems to be a kind of a pattern here of like, I should know what's going on with me before I reach out.
Yeah.
It's kind of like rearing its head right here. Mm-hmm. Talk to me about what is that all about with women that have this idea of how they should be or shouldn't be. Mm-hmm. Like what's all with this thing?
Yeah. Well, think about society, how you should look, what size you should be, it's like all about, it's like women are supposed to have, tight abs and flat stomachs. Unless you're pregnant, then you're still judged on your baby size and how big your bump is, it's like, you can't win, and so there's always these shoulds from the time you're little, you should get, A's and B's, you should be in extracurricular activities, you should go to college, there's always these shoulds. And so we just naturally internalize those messages from young girls. A lot of my clients, they talk about 8, 9, 10, their anxiety started, they started having this internal sense of like, I'm not doing enough, or what should I be doing? Or, and it develops at a really young age. And so fast forward, in your 20s or 30s or 40s, having babies, and you've got this whole line of shoulds, it's kind of this, I described as like a playbook, where you're like, this is what we should be doing. This is what I should be doing. This is how I cross my T's and dot my I's, and so, and then that's just women in general in our society. And then think about moms, like, oh my gosh, what school are they going to? Did you pack a healthy lunch? Is that baby sleeping through the night? Are you breastfeeding? There's a whole list of shoulds and questions. And
so what I'm hearing is like, there's a game that all women play, but no rules or playbook is really written except in everybody else's head. How anxiety provoking not knowing if you're winning or not.
Yeah. Well, the fact there's even a game, like we need to like throw out the game,
right? Because that's the only time there's a should, right? Like if I'm playing a game with you and I move my piece, now it's your turn. You should move soon.
Yeah. And make the right choice and do the right thing, and it's like all this like tension and this big, like everything's riding on this one decision, and I help my clients take a step back and kind of get a bird's eye view of like, what is this decision you have? What, it's not life or death. Like if you have this baby and you're struggling and you're like, I can't nurse anymore. I can't, give the bottle, it's just all this pressure to be like, nope, I got to do this, or diapering because you don't want to fill the landfills. It's just
the shoulds. Yes.
yeah. So it's like that's where that anxiety comes from, is like, I want to do well at this game in life, but how do I, and what's going to happen if I don't, or if I miss it, and it's really just like helping my clients kind of take a deep breath and let that go is a continual process, because we have that from such a young age, you know?
That's true. I think a lot of times we encounter postpartum issues, whether it's anxiety, depression, et cetera, when we're working with a couple, and then we find out, we start like some of the facts start coming out where they're like, yeah, our toddler is still in our bed and he's 3, or, we haven't gone on a date. We haven't been overnight by ourselves and our child's 5, and like they just have this pressure to have to like hover over their children. And, that's
another should, right?
Another should, or even just the mom guilt of, leaving a child with a trusted person. And then questioning whether they can trust them or whether their child will be okay with them. And so that's oftentimes where we see it coming out, and it's not usually in those first few months after having a baby. Talk to us about the timeline patterns that you see in your practice. Like sometimes maybe it's a year or 2 or 5 years out from having a baby that you see some of these symptoms come up.
Totally. Yeah. Well, and it's, postpartum depression is considered in that first year after birth. But like you're saying, there's these other issues or, kind of topics that keep kind of stringing along. So maybe that mom, gave birth and she's really anxious about caring, for that child and all these what ifs and these shoulds and stuff, but then that never gets resolved, or that, what's that underlying issue? What is she afraid of never gets resolved? Or maybe she had trauma or a past, a history of abuse that's going to influence what she does with this tiny child that she, cares for, so maybe that child is 5 now and, still sleeping in the bed, or she's not letting anybody watch that baby still, or, and it's, it really does play out in different ways over the years. And it's hard. I think it's a very complex, situation. And we want to tell her, just do that. Just, leave that baby with your husband, or go away from you guys need this as a couple, but that's really traumatizing and anxiety for her. And, how I do my work is I try to empower the mother or the woman, or the girl as much as possible, and be like, okay, where is this coming from? What do you want? What do you feel comfortable with? Because for the mother who can't let that baby or that child out of their sight, even with their partner or their spouse, like what's going on with that? And, being careful not to put more shoulds on her, and more pressure of like, you need to be doing this and you missed this and you did this wrong, and so really as professionals and friends, taking a step back and being like, where is this coming from?
Where's this coming from? That's a good first step, ladies. If you're listening and you're like, oh, that's me. My kid's still in my bed, or I haven't gone on a date with my husband in years, ask yourself, where is this coming from?
And I would encourage women too, to be gently curious about themselves, because it's so easy to go within and then put all the more shoulds and labels and stuff on themselves.
Right. And for other people to do that too. She's already feeling all this, condemnation and
let me pile some more on.
Yeah. So when people are like, hey, when's the last time you had a date? Or when's the last time you went overnight? And they're like, never. They're like, oh no, I'm doing something wrong. She's like, I told you, I'm already screwing this up. Like she is already feeling that way.
Right.
So it's really hard. It's a fine line between encouraging this person to, take a step in their growth, and on that path, and really digging deep and helping her heal that, that area. Like I tell my clients, if you're out camping and there's leaves rustling near your tent and a chipmunk jumps out, you're going to be like, oh, cute, a chipmunk. But if leaves are rustling and a bear jumps out, you're not going to be like, oh, a bear. You're going to be running or getting in the car, And so if a mom is, saying she's not going overnight with, her spouse or partner, whatever, and somewhere along the way, the leaves rustling meant a bear, she's not going to leave that child with anything, so there's really going to be trauma or, past negative experiences to work through. So it's hanging on the surface is like, this is what you should do. Check this box, go out of town with your husband. But if rustling leaves meant bear, she's not going to leave that child.
That's such a good point. Yeah.
Really
what are some other reasons why someone would feel anxious about leaving their child when, they have trusted people in their life and they just still feel like they can't go to the store by themselves while, the baby or the child stays with a trusted person. Maybe they don't have particular like sexual trauma or neglect or anything that you would label as trauma, but what would be some other reasons why she might feel hesitant to leave a child?
We'll be right back to the interview, but first we wanted to share something that we are really excited about.
So, we all have those times where we don't feel super connected to our spouse and we really don't know what conversations to have to get us to that connected place. And then on top of that, we're so busy that we don't prioritize those conversations.
And that's why we created the monthly live date night.
And monthly live date night is every month on a Friday night for 90 minutes, 60 minutes. We focus on a topic that you guys pick. And then 30 minutes, we do a Q&A and it's live where we're all together asking questions and giving answers on topics related to your marriage, your intimacy. And we share tools. We have handouts that we call homework because we want you to be there to listen and to soak in, but we really want you to take action in your marriage too.
So come join us live for the next monthly live date night. Check the link in the show notes for dates and details.
All right, back to the interview.
Right. Well, there might not be a big again, we compare ourselves, to others or we have those shoulds. And so maybe she wasn't sexually assaulted, but maybe her delivery was really traumatic and, she experienced trauma in, your most vulnerable states. And so there's maybe not this big T trauma where it's like, oh, this happened to me, but she's like, I still feel traumatized. I still feel like something happened to me, but I don't know what it was, but I'm not going to trust other people now, or I'm, so it could be this way of, it's like we compare ourselves all of the time, and Brene Brown calls it like the comparative suffering, where we're like, well, that person lost their leg in the car accident. I only lost my foot. So I shouldn't complain because at least I have my leg. And it's like, no, you're still missing your foot, like that. If it's traumas in the, eye of the beholder, if you were traumatized by that, it's, you're traumatized and, dealing with that and not comparing yourself to somebody else. So
that's good. So whether it's a big T or maybe a little T that you're just not acknowledging the impact of, it's time to acknowledge that if that's, if that's something that's holding you back from getting what you want in your relationship or in your peace in your home.
Right. And just how you see yourself as a mother. If you feel like there's something holding me back, but I'm not sure, like, that's okay. That's another great reason to go talk to a therapist and kind of dive into those things. Like you want to be able to find a trusted person that can really go to those deeper places with you and figure that out. And, with women, if you think about sexual assault, they say 1 in 4, are sexually abused. That's a high percentage. And I, again, feel like that's underreported as well. And so, even if you have this abuse in your childhood and you've never been abused again, but there's something in your birth that triggers that, like that's going to be coming, back up and, having to work through that again. So, there's a lot of, intricacies, and it's a complex topic. So, looking outside, you might be like, oh, she just needs to such and such, but it's like, why isn't she, what's going on with her?
Getting curious. What are some of the modalities that you use in working through trauma? Say maybe trauma that's triggered at birth, when folks go through that intense pain and just the most intense experience of their life, and it kind of brings them back to unprocessed trauma from earlier on. What modalities do you use to work through that?
Yeah. So in general, I use CBT, cognitive behavioral therapy, and mindfulness. And really just a lot of somatic body work of, like I was saying before, like, where is your body? What is it doing? Checking in with yourself. And a lot of times talking through and really, pulling apart that yarn from that ball, helps a lot. And if somebody continues to have really maybe just one specific memory that's just stuck, and, then I'll refer out for EMDR, because I'm not trained in EMDR.
Okay.
Or brain spotting or something. And that can be super helpful to have them work on that with another clinician and then come back. But yeah, really, that long-term trying to figure out, cause it's like our brains, it's like, the neurons that fire together, wire together. And so it's like all of these experiences all come together, and this is related to this, and this is related to this. And, so really talking about that and working through that long-term is super helpful.
Yeah.
Just two therapists talking shop here. But a great book to kind of fill in some of those gaps would be The Body Keeps the Score by Bessel van der Kolk. That's a fabulous book talking about trauma and its effects, and how, well, just like the title says, how trauma is stored in the body and the body remembers, even though you may try to stuff it into a closet.
Yeah. Yeah.
Right. And so that mom that's not leaving her baby with somebody else, or not able, to go back to work because she's like, I can't do daycare, or I can't have this person watch my child. Yeah. And they don't know why, she doesn't know where that's coming from, because her body's kept that, memory that she might not cognitively be aware of that, and with trauma, a lot of times memories are impacted, and, really being able to remember, details. So
I was working with a client just recently, and we were going through a memory, and I remember he just absolutely broke down. He said, "Oh my word." He's like, and he just started describing more of the memory that he had completely forgotten. And it wasn't, and he just broke down because he's like seeing all these new things. And this is a older man. And so for all these years, those memories were there, but he wasn't aware of them until we went there. And so, yeah, this happens all the time where like memories will come back, but it's healing too. It really is.
Totally.
Right. And it's so validating to have somebody else in the room that you're able to talk to, and share that with, and not have them recoil in horror, and like, it's okay to talk about this. I just had a client who, she was in her 70s, and she had a miscarriage when she was in her 20s, and had never talked about it, 50 years ago. That wasn't really a thing to talk about that. And she didn't realize that it was so painful and hard for her until her daughter-in-law had a miscarriage. And all of this flooded back for her. And I'll never forget her sitting in my, in the therapy room and going like, can this be a thing? Can I still be bothered about my own miscarriage 50 years ago? Because I never thought it was a thing. And I'm like, yes, and so it was really beautiful. She, her process of, processing that grief and working through that, and being there and supporting her daughter-in-law, as well as healing her own pain. It was so beautiful. But
Wow. Do you see an impact on pregnant mothers who have experienced a miscarriage before, like in their levels of anxiety going to each scan, and, whether their baby will be healthy?
Yeah. Having infertility or a miscarriage or, infant loss, those are all risk factors for postpartum depression. So, all of those, like we talked about abuse, all of those things heightens anxiety, is a risk factor there. So if you've lost a baby through miscarriage, you're going to be more anxious before the scan, or, I'm walking through, a friend right now with that, and it's really hard. And I'm always just validating her of like, yep, this is hard. This is Like you cared for that baby. You loved that baby that you lost. You're not going to, those leaves rustling in the woods meant a bear. Like you lost your child. You lost, you lost your pregnancy. That's not a chipmunk. It wasn't a scare. You really lost your child, and it's really validating that for her, and for clients. So just like people validating themselves is huge. Like I'm always encouraging my clients, validate yourself in that. Be like, yep, I'm having a hard day because of such and such, and that's okay. I don't need anybody else to validate that. I don't need to compare it to somebody else's suffering. That's enough for me. That's okay that this is hard for me. And that's another thing that's hard with women. Everybody responds differently to a miscarriage, and some women are like, yes, it was hard, but they recover easier than other women. And so if you're somebody who's still having a really hard time, grieving the loss of your child from miscarriage, really honoring yourself in that and letting that be okay, that just because it looks like somebody else moved on from it and you're not, that's okay. You don't need to,
totally. It's okay to grieve.
Yeah. And naming it to tame it.
Yeah.
I've heard it said,
yeah,
being able to admit the fact that, hey, this is happening in me. And just that, it's the fact of the matter. It's not like something you shouldn't do or, like trying to hide it. I think there's a lot of progress can be made if you just sit with it and acknowledge it.
For sure. Sarah, talk to us about some of the differentiating factors between postpartum depression, anxiety, and psychosis. I know some of the symptoms are overlapping, but can you kind of help us differentiate the three?
Yeah. So first of all, kind of the baby blues that people are like, is this depression? Is this the baby blues? Beyond the Blues is a really good book by Shoshana Bennett. And that book will talk about what the baby blues look like, kind of how long it lasts. It's shorter, it's kind of comes and goes and waves, than what anxiety and depression looks like. So that's a really good book, but just in general. So, there is a subset of postpartum anxiety called postpartum OCD. So obsessive compulsive disorder. And I screen for that with my clients in session because a lot of times women experience these intrusive thoughts that kind of pop into their head. And it's like, what if something happened? And sometimes it can be them, like they're giving their baby a bath. What if I push my baby under the water? Like, I don't want to give a bath anymore. I'll have my spouse or my partner do it.
Yeah.
And so some women have these thoughts, and I've worked with a lot of women with those, and they go, oh my gosh, I'm like this horrible person that I even thought of that. Like, what's wrong with me? Is this, postpartum psychosis where the person really does, inflict harm on their child. And so it's this terrifying thought that they're having, even these thoughts pop into their head. And the huge, deciding factor of which is it postpartum OCD or postpartum psychosis is really, in psychosis, it's a break with reality. And this thought that pops, that comes into their head is a comforting thought. And in postpartum OCD, it's not a comforting thought. They're like freaked out that this thought popped into their head. They're like, I was walking, on the bridge with my baby, and I thought, what if my baby suddenly fell over? This is terrifying to me. It scares them. So they're like, I'm going to walk away. I'm not going to have my baby near the edge. Or if I'm worried about, contaminants or, poison or something, I'm not going to make their bottle. I'm going to have somebody else do it. They have a scary thought, and then they decide to go away from that thought and have somebody else do the activity or whatever.
Okay.
And postpartum psychosis is it's a break from reality where they're comforted by that thought, or they're, they're not bothered by it.
And they move toward it even and take action.
Toward it. Yeah. So that's where it becomes this crisis where they need help and medical intervention. But the postpartum OCD is where there's these, what if thoughts all of the time. And they're, one of my first clients 10 years ago struggled with that, and it was terrifying for her. And then I've seen it ever since. But at first it was like, she was like, are you going to call CPS on me? Like, can I even tell you these things in my head? And I fully assessed her, and I knew it wasn't postpartum psychosis. And I'm like, yes, you can talk to me about it. Like, that's this what if thought, and anxiety. What is anxiety? Anxiety is that what if something happens? What if I lose my job? What if I, whatever. And so that's that same experience, but it's what if harm comes to my child? And it's this intrusive thought that pops in. And so really working with a mental health professional to work through that is imperative, because it's terrifying. And that's when the mom might, be showing this behavior that looks odd, but it's because she's trying to make sense of this thought in her head of like, I don't want to be anywhere near, the stairs with the baby. So I don't want to walk up and down in our townhouse with the baby,
Yeah, that's really helpful. I think that helps a lot of women realize like they're not I think they would use the word crazy, but they're not experiencing the postpartum psychosis that they hear about in the news just because they have these intrusive thoughts that come into their mind about the what ifs. That falls under that anxiety category, the subset of OCD, not the psychosis category where it's a detachment from reality.
Right. Yeah. I had a mom, this was probably last year, frantically, emailing me and like, can we have a session? And, and in the session, she was like, I have this what if thought, I have this what if thought, and these are really scary to me. And like, are you going to call CPS or, and so I had to do a full assessment, make sure it wasn't postpartum psychosis, but I was like, no, this is, OCD, this is how this manifests. This is, and then I never saw her again. She was like, I'm good. Like, she just needs somebody to like, laugh,
Yeah.
And she was like, okay, I'm not crazy. Okay. I'm good. Like, I don't back, cause it's terrifying. And then when you think about that list of shoulds that, that all of us moms have, and then you have these scary thoughts that pop into your head, you'd be like, oh my gosh, what's wrong with me?
Yeah. And sometimes the treatment is just voicing that and realizing that you are not detached from reality, that everything is going to be okay. And sometimes that will help the thoughts subside, just acknowledging them. And then, they kind of, it really does kind of peter out after that. And I see it happen with folks. Sometimes it just takes a few months even. And then, they're kind of equilibrated. They find their equilibrium again.
Right. Yeah. And some, for that one client, they're like, I just need to talk about it, and then it's gone. And others, it's an ongoing battle that they're like, I keep having this. This is terrifying to me, so it really can come in, both extremes, but just being like, what is a framework for this, that this is this what if thought, this is OCD, this is not me. This is not a reflection of how much I love my child or how well I'm safe. This is this thing. That's not me, and really like separating that is powerful.
I find it very helpful for people just kind of like walk them through the idea that they have thoughts. They are not their thoughts. Like you're the thinking thing. You're not the actual thought itself. So you can have thoughts that have no bearing to reality.
Right. Yeah. It's not you. Yeah. And I sometimes for my clients, it's helpful when I describe just kind of watching it like a cloud going by. Like, you're not grabbing that and holding that of like, that's me. You're just like, yep, I had that thought, especially for the what if thoughts and the postpartum OCD is like, it's just like watching a cloud go by. It's passing by. Don't hold on to that. Don't expend a ton of energy trying to fight that off. Just know, yep, that's the postpartum OCD thought. It's going by, not okay. I'm moving on, and so that can be a really helpful tool to how do I make sense of this? This thought is not me.
Yeah.
Because the pain is when the person reaches out and grabs it and lets it, get them cold and let it rain on them.
Yeah, exactly.
Right. Yeah. And they're like, oh my gosh, I'm having this thought. How do I fight against this? What do I do? Like, do I need to, be inpatient? Like, what do I do with this? This is terrifying. Yeah. And it's like this mental, inside this horrible pain they're going through.
Yeah.
And yeah, the one client that that I worked with 10 years ago, that was really helpful to her, of just watch that thought cloud going by.
Mhm.
Don't grab it. Because it's exhausting when you think about when you're anxious or when there's a big emotional event and you're expending all this energy fighting it. And, and then it's like, whoo, it's exhausting, but you still have life going on. You still have that baby for those kids to take care of. And so you're already drained. And so if you don't even hold on to that thought and you just see it out there, you're not tired then,
Yeah.
Right. So good. It's like a gentle nod of acknowledgement of there you go. That's a cloud.
Yeah.
Right. Here, I'm going to go change this poopy diaper.
Yeah.
Yeah. I that thought, it's not mine. It's not mine. It's not me. It's not something I have to fight against. And changing that poopy diaper. Yeah.
That's good. One more question for you, Sarah, before we move to our end of episode questions that we ask each interviewee. But one more question for you is, if a husband is listening and he's like, how do I help my wife? Like, this is what she's going through. She has some blues, or she has these obsessive thoughts. What's one step that he can take?
Or maybe a friend.
Maybe a friend is listening. What's one step that they can take to talk to this mom and kind of help her feel safe or resourceful?
Right. Yeah, that's a great question. I think the number one thing is showing her, this mom, that you're not going to judge her, that whatever she tells you, however, whatever those thoughts are inside her head, it's okay. And you still love her, you still support her, because somebody's never going to share scary thoughts in their head if they feel like they're going to be judged or their baby's going to be taken away. They're just like, nope, I don't have anything. Like, they just lock that away. And so really showing that of hey, I'm here for you. I care about you. We're in this together. What's going on for you, share this. And it's probably not going to be one conversation. It's probably going to be over and over reminding her that, hey, I see that this struggle is there. Or I see that difference, or, what's going on for you? Talk to me about that,
That's good. I love that. Just that non-judgmental stance and creating that container, we call it,
Which is easy to have, I think, if you have that framework of, oh, you're having these thoughts.
Mm-hmm.
You're not crazy. It's funny how often I hear from women that's a deep down fear, oh, I'm not crazy.
Yes.
I didn't think that was a thing until I talked to a lot of women.
Yeah.
And it's oh, that's a common thing for women.
Yes.
They have all these emotions that are so fierce that they sometimes question their own sanity. It's no, you're fine. You're okay.
And we get so much relief when we're, when it is normalized and we're like, oh, I'm not crazy.
Right. Yeah. How powerful is that when you're like, hey, what's going on for you? And, oh, I struggle with that too. Or, oh, that's a common thing. Or, I always tell clients the first session, I'm like, whatever you tell me, I've heard it before.
Yeah.
It's common. Just know it's not just you, and that's very, very reassuring to people because it started when we were young, that we were told do this, do that, and life's unpredictable. And there's a lot of things that we can't, especially working with a lot of people that have just graduated from college. They're like, well, I'm done with school. What do I do now? What makes me successful? How do I,
Yes.
Is it a job now? Is it how much I make? Is it the benefits? What makes me successful? Really the cry of everybody's heart is will you still love me if you know about me? And so really assuring the person of that, if you're the friend, the spouse, the therapist, I'm still here for you. Don't worry about it,
Yes.
So,
we all want to be fully known and fully loved.
Yes.
Yeah.
So good. This is all such good stuff and helpful. What would you suggest that maybe if people want to continue in this direction for resources? I know you mentioned a few. Can you think of any other resources that you could suggest for people that may be going through this sort of thing?
Yeah. There's an app that you can download on your phone called Mom Jeans.
Okay.
And It's created for women that have gone through postpartum depression, maybe in the past or currently, and they will have questionnaires. It's like part of this whole research study. So they're trying to analyze genes and see if there's a component of who
Interesting.
who doesn't. They'll do a saliva test. Yeah. So it's really cool. And that's a big thing, that if you are going through this, to feel like this is not for nothing, I can help other people, or I can help, raise awareness. And so that's a really cool app.
Neat. Okay.
And then, Postpartum Support International is amazing.
Okay.
Like I mentioned, and, just finding those local, like on Psychology Today, people don't know that you can check boxes of, either if you want to see somebody in telehealth or in person, or insurance, you can check the box of your insurance, or, anxiety, postpartum depression, all of those things.
Yeah.
And, people don't know that they can use that.
Find a specialist.
Exactly.
Yeah, somebody, because if you see somebody, potentially that doesn't know that your postpartum OCD thoughts are not psychosis, you really want to see somebody
a specialist,
has been trained in that. So
speaking of specialists, tell us where people can find you, give us your information, and we'll include it in the show notes as well.
Okay, perfect. Yeah. My website's sarahsanderslmft.com.
Mm-hmm.
And then people can email me at sarah@sarahsanderslmft.com.
Okay.
And I just created a nice, pretty little handout for creating a postpartum support plan. So I'm big on everybody, regardless of if you've had kids or if you think you are going to have postpartum depression, whatever it is, to have a postpartum support plan.
That's brilliant.
Like physical, emotional, mental, how to get all of those things figured out and lined up so that you can go into this birthing experience and this new motherhood experience with the most support and love, and care. Cause it's really focusing on the mom is huge. A taken care of mom will take care of a baby very well,
Yes, that's so, say that again. That is so good.
Yeah. So I say a happy mom, a well cared for mom makes for a happy baby, and a well cared for baby. So we don't need to focus on the baby. If everybody's focused on the baby, who's focusing on the mom? But if we all focus on the mom naturally, will focus on the baby and take care of that baby. So good, Sarah. Thank you so much. The last question that we ask every interviewee is just rewinding back to the first year of your marriage. When you, how long have you been married now? 14 years. 14 years. So rewinding back to that first year, what's advice that you wish you would have received? And then fill in the blank, dear young married couple. Okay. Dear young married couple, trust in yourself and not have any topic unturned. Talk about everything with your spouse. That's good. Yes. Well, thank you so much, Sarah. This has been I think so fun to have you on, but also a blessing to our community to just be able to pick your brain and
reap the benefits of a decade of work.
Yes, hear your insights. So thank you so much. Yeah, thank you so much for having me. It was awesome. Absolutely. All right.
Thank you, Sarah.
All right, friends, we really hope that you got a ton out of today's conversation. And if you want help, if you want personal guidance with individual counseling or couples counseling, or even help with you as a couple reaching the goals you have, just reach out. Give us a call at 916-678-1797 or shoot us an email at hello@dearyoungmarriedcouple.com.
No matter where you are in the world or in your marriage, we can set up a counseling session with you and we can work toward progress. We also post marriage advice regularly on our Instagram, which is @dearyoungmarriedcouple, and we'd love for you to join us in conversation there. All right, see you next week.